Hey friends, I'm Yash, and today we are continuing my series on the MedTech and healthcare industries, where I talk about the challenges and opportunities in our journeys to provide timely, affordable, and quality healthcare. In this installment of MedTech Annals, I'll deep dive into the concepts of access to healthcare and interoperability within the industry. So we'll be talking about many things within these two broad categories, such as the iron triangle and sustainable healthcare. Timestamps to everything are in the video description, so do feel free to skip around to whichever part interests you. Having said that, let's get on with part 1, access to healthcare. When we ask ourselves, how can I get more patients into the hospital? Our answer lies within outpatient services, the department within a hospital responsible for the diagnosis and treatment of patients who do not necessarily require a bed. Improving outpatient services such as diagnosis and rehabilitation at its core require two things: increasing the capacity and capability of outpatient services. The goal over here, in very short, is to promote something known as efficient consumer behavior, characterized by patients who come at the right frequency, at scheduled time, and with all their pre-work complete. In a 2014 McKinsey white paper, it is said that provider systems such as hospitals and outpatient services require both efficient consumer behavior and consumer loyalty to make the entire patient journey as simple, easy, and user-friendly as possible. In our book by a good friend, William L. Kissick, he introduces the concept of an iron triangle, the so-called gold standard for healthcare. Owing to this video's topic, the three legs of the triangle are quality, cost, and access. The iron triangle in itself talks about intrinsic trade-offs within the healthcare ecosystem. Trying to improve any one or two segments of the triangle would come at the expense of the third. For example, if the healthcare ecosystem focused on quality and access of healthcare, they would end up overpricing their service, which is bad. Until quite recently, however, it was realized that this golden standard could be broken out of. If the healthcare system does have quality and access, it can use medical technologies to reduce the cost of their service. Basically, it was realized that medical technologies could help us prevent the intrinsic trade-offs while trying to improve either quality, cost, or access. Now, as we explore what deviations from this gold standard might look at, it's key we focus on the current state of our healthcare systems. Through the course of the pandemic, we have seen that there have been an increased number of medical technologies introduced into the market. This has not only been seen in developed markets and economies such as Singapore or the United States, but financially poor or less developed economies as well. In the present context, the disruption in terms of technology and innovation has been seen mostly in the COVID care sector. Why has this particular segment selectively grown as opposed to the entire healthcare industry? Rather evidently, this selective growth in the medtech and healthcare industries has been fueled by changing priorities of financiers, regulators, and clinicians. Patient choices and access to treatment other than COVID care has been ignored in favor of giving access and priority to frontline workers. Though there is no issue with this in the short run, the industry faces a serious risk of backsliding in non-COVID care. What we don't want in any circumstance are pre-pandemic treatment methods in a post-pandemic world. Despite the fact that our healthcare systems are under terrible and unprecedented pressure, it's key that elective procedures don't get deprioritized. Elective procedures are surgery or care that have been scheduled in advance because they do not involve a medical emergency. Stakeholders in the healthcare industry still need the mental bandwidth to think about these kind of procedures. Deprioritizing these procedures and in some cases pushing them back would mean backlogging elective procedure and care plans, which even before the pandemic, to be honest, were not really ideal. If you were to take a step back and kind of look at everything, you would realize how rigid our healthcare systems actually are. And it is this rigidity in our healthcare systems that introduce high levels of variability and uncertainty. Unlike other sectors and businesses which happen to exist, the healthcare and medtech industry run a unique risk because they manage supply chains and resources which have direct impact on human life. So it's imperative that we reduce this uncertainty because we are dealing with consequences in terms of human life. How can we reduce this uncertainty? Well, the first option is to preserve gains from the innovations and technologies that have been introduced through the course of the pandemic. And the second way we can prevent uncertainty is building an industry which is focused on value creation in sustainable systems. Basically, what that means is systematically categorizing and weeding out technologies or even systems which, number one, do not add any particular value, and number two, do not add value in a sustainable manner or within a sustainable system. Truth be told, for all our talk about sustainable care, a large portion of which is value-based care, a majority consensus is that we are not realizing the true potential of what real sustainable care or what real value-based care might look like. Just to brush up on the fundamentals, value-based care is when you provide the highest quality of care at the lowest possible cost. Now, if we can't reach this potential, it is due to the extreme fragmentation and diversity of the landscapes our medtechs work in. Our healthcare systems have not yet reached the point where it's economical, viable, or even possible to provide value-based care. To change the current trajectory of the healthcare industry, it must focus on data and the participation of payers and providers. It must do this while guaranteeing positive patient outcomes and ensuring interoperability within each system. Having said that, let's talk about interoperability within the healthcare system. So, what is interoperability in healthcare? The industry defines interoperability to be the ability of different systems, devices, and applications to access, exchange, and integrate data in a coordinated manner. Now, obviously, this would happen within and across organizational, national, and regional healthcare systems, all in the hopes of providing timely and seamless portability of information. Now, portability of information is obviously in aid of improving and optimizing global health outcomes. If I'm to serve in an interoperable healthcare system, from the perspective of a consumer, what do I need? And from the perspective of a provider, what or how do I know I am producing what the consumer needs? Now, to answer this from the perspective of the producer, there are 4 questions any manufacturer can ask himself. For a manufactured system to be truly interoperable, it should, number 1, be able to exchange data from product to product. Number 2, it should be able to exchange data not only with other products within the company's portfolio, but with products outside the company's portfolio as well. Number 3, the producer or manufacturer should ask or question the existence of an MDI. An MDI or medical device integration is any software-based application which can collect, integrate, or append the vital signs of a patient. An MDI would effectively collect, store, and append vital signs such as body temperature, pulse rate, respiration rate, and blood pressure to a centralized system or a centralized register of all that information. I'll link a page below to the IHI's website which talks a bit more about MDIs if you're interested to know more about it. If the manufacturer knows and understands the MDI standards required for their manufactured product, it can ask itself how to leverage and make the most of the technology within the MDI standards. Truth be told, these 3 features of interoperability was just another thing the pandemic seemed to trigger on a global scale. The reason this has been the case is that the pandemic has allowed us to realize and recall that our healthcare systems are fragmented in many ways. This yields a lot of unused healthcare data which is not being used to further the scope of care or being developed in any form. In the end, what the healthcare system really needs is a collaborated effort to preserve key gains from innovation throughout the pandemic. That is the only way we can break out of the iron triangle and advance the quality of care. So having said that, I really hope you liked this video and derived some kind of value out of it. Do consider subscribing to the channel if you have not already, and I'll see you in the next video which will talk about reimbursements and financial models in the healthcare industry. If you have any questions, do feel free to post them in the comments and I'll try and answer them with as much knowledge as I have, hopefully quoting academic papers and studies along the way. Thank you so much for watching and I'll see you in the next video.